Services for people with intellectual disability or autism were seriously threatened as the Commonwealth suffered during the coronavirus pandemic. Many providers either shut down services completely or greatly diminished their service capacity. We've faced funding problems and a workforce crisis for years. During the pandemic, we've tiptoed on razor-thin margins in order to keep the system from collapsing. We've made it through thanks to the fierce dedication of provider staff and partners all around the state. PAR and our partners' efforts resulted in IDA providers having access to almost $400 million in COVID-19 relief funding. We thank Governor Wolf and the Pennsylvania legislature for authorizing $260 million in CARES Act funding and $5.5 million in hazard pay grants that went to Pennsylvania IDA providers. We also appreciate the U.S. Congress for passing $70 million in provider relief funding and $61 million in PPP loans that went to Pennsylvania IDA providers. We'd like to share with you what went into the successful passage of this legislation.
PAR met with over 70 legislators and sent over 4,000 messages to the legislature and Governor Wolf.
PAR obtained over 100,000 pieces of PPE for our members who were unable to secure on their own and reached out to over 50 news outlets to connect our members with donations from their local communities.
PAR created a members-only COVID-19 forum to provide support and information and an In the News webpage to house the 25 articles published about the need for IDA funding.
We published impactful reports on the challenges providers faced as a result of COVID-19. We also met regularly with our board of directors and scheduled weekly meetings with our executive committee to guide our efforts.
We held 4 virtual press conferences that were attended by hundreds of people, including media outlets, legislators, family members, providers, and industry leaders statewide.
We also held 4 PAR EDU events about the impact of COVID-19 on providers and their businesses.
PAR sent 81 PAR mails to our members to share information about COVID-19 and our advocacy.
Then we gathered over 20 videos from members across Pennsylvania to create a video compilation so we could tell our story to Governor Wolf and legislators. We created www.par.net/tellingourstory on our website to house each person's full video, as well as the 4-minute compilation video, which was viewed 500 times.
And PAR provided comments and information on behalf of providers to the Department of Human Services, the legislature, the Department of Health, and the governor.
We tweeted 99 times, posted on Facebook 109 times, and grew our following by 200 followers while raising awareness about our COVID-19 advocacy.
PAR created the WE Project, WE standing for Wage Expansion. We are a coalition of human service provider associations, which include aging, childcare, IDA, and physical disabilities, all working together on a goal of increasing direct care staff wages to $15 an hour. You can check out our website that we created at www.weproject.info.
We had over 50,000 registrations, which included members and non-members, for dozens of Zoom meetings, town halls, and trainings.
We handled all the purchasing, invoicing, and payments of PPE supplies for our provider members, giving them one less thing to worry about during the COVID-19 crisis.
Hi, I'm Candy Condren, and I'm the assistant to the president and CEO.
My name is Desiree Hung, and I'm Director of Policy and Legislative Affairs.
I'm Alana Gruber, Policy and Education Associate.
Lisa Mathis, Director of Policy and Administrative Relations.
I'm Rebecca Glick, Senior Policy and Government Relations Specialist.
I am Lauren Quigley, Operations Manager.
I am Mel Knowlton, Senior Policy Consultant at PAR.
Hi, I'm Cammie Breadbenner, Marketing and Member Services Director for PAR.
I'm Rhonda Westman, Administrative Assistant.
I'm Joanne Wrights, Bookkeeper for PAR.
I'm Mark Davis, President and CEO of PAR. Times like this are exactly why PAR exists. On behalf of the staff at PAR, I'd like to thank you for putting your trust in us and working side by side with us to ensure that individuals with intellectual disability or autism and their families have the services and supports that they need to be safe and healthy during the coronavirus pandemic. Thank you.